can resist the lure of better pay, much better pay, in a richer country? That is the temptation that nurses all over the world face today. As developed countries like the United States seduce them with dollars, their home countries are deprived of their skills. We take you to Guyana in the Caribbean.
A country of just over 700,000 people, Guyana is rapidly losing a valuable asset: its skilled nurses. Lured by offers of as much as $55,000 a year, far exceeding what they could ever hope to earn back home, some 25 to 50% of Guyanese nurses are leaving the country. Jacqueline Gulstone is one of them.
Economically, things became better for me when I came to America, United States of America. And that was the reason why I migrated.
But money was not the only reason.
I wanted to develop myself in terms of my education.
Jacqueline received her nursing diploma from the prestigious Guyana Nursing School.
I am grateful that I was trained in Guyana. I didn't pay a penny for my training in Guyana. I had 4 years of training and 4 years of quality training that I am very proud of.
Wanting to study further and earn more, Jacqueline eyed the United States as a land of new opportunity. Settling in Brooklyn, New York, she worked hard to fulfill her dreams. During the day, Jacqueline worked as a nurse. By night, she hit the books. Today, she's a nurse practitioner at Brookdale Hospital Medical Center. American hospitals like this one are starved for nurses.
There are people who are interested in going into the profession, but because there's not enough educators to teach these students, what happens is that the class sizes are very small, and the number of nurses that they can go through the programs is really diminished.
Brookdale's Director of Nursing, Susan Panaccio, says with too few nurses graduating from American schools, American hospitals are forced to recruit from abroad.
Many of our nurses come from the Philippines, from Guyana, from some of the Caribbean islands.
But what's helping the US is hurting here in Guyana. Harold Robinson of the UN Population Fund, UNFPA, believes that the exodus of nurses is affecting healthcare.
All the efforts, not only all the country's efforts in terms of reducing maternal mortality, but all the health sector efforts are really constrained by this out-migration.
It's also putting pressure on nurses like Andrea Duncan, who decided to stay behind. She works the day shift at the state-run Georgetown Hospital. Caring for pregnant women, she stretches herself thin, handling a heavy load.
We try to give the best care as possible. Now, when you have a shortage of staff and the patient, you have lots of patients, you cannot deal adequately with one patient. You cannot listen to the patients properly. You cannot get to do what you would like to do or what you were trained to do as a nurse.
Andrea is now finding it hard to juggle her wages against rising costs.
Everybody wants to afford to do what they have to do comfortably, right, for the families and for themselves.
Over the last 50 years, Guyana has trained thousands of highly qualified nurses. But as fast as they train new ones, they're being scooped up by other countries with severe nursing shortages. Dr. Leslie Ramsamy is Minister of Health.
Let's not have any doubt and make no bones about it. Migration of our health workers impacts severely on achieving health for all.
Still a poor country, Guyana pays its nurses less than $300 a month. It's not enough to get by.
If salary, for example, is one thing that attracts people to other jurisdictions, there is no way that we will compete in the foreseeable future with the United States.
Doctors are also feeling the brunt. Lu Pin Hong, a Chinese gynecologist working in Guyana, treats women who can't afford private care. She desperately needs nurses to help her.
There's a severe shortage of nurses. Often there's one nurse on each floor. That's not enough for hundreds of patients. Usually we have to wait a long time until a nurse is available to help us.
In exchange for free training, all Guyanese nurses sign a contract agreeing to work between 5 and 8 years in the country. If they break their contract, they must reimburse the government.
I had almost completed my contract, probably like a couple of months short of that before I left, but I still had to pay some money.
But now Jacqueline is anxious to repay some of her country's investment in her training. She raises money in New York to fund a group that provides care to those in underserved communities in Guyana.
They gave us this free training, and then we left. I haven't planning going back living there, but I can in some way, in some small way, I could contribute to what I got from Guyana.
And the government is grateful.
They have helped to reduce the gap and the deficit that exists in terms of financing. They've been able to provide some much needed human resources.
But medical missions alone can't offset the effect created by a steady drain of local nurses. And the current economic crisis isn't helping either. Surviving on local salaries is difficult. Now, even more people are thinking of leaving, including Andrea.
I like this country. I like to be here. But if an opportunity presents itself, I go. Right? Because I've served my contract.
To compensate for expected losses of nurses, Guyana has already increased class sizes. This year alone, some 700 students are being trained. Close to half will leave without fulfilling their contracts. And it's costing the government $4,000 to train each nurse, money it could be spending elsewhere.
There are still people without water. There are still people who need help for housing. We still have drainage issues to deal with. It is unfair for a country to have to double its capacity.
It's an ongoing battle for Guyana to guarantee decent health care for all. And with the constant flow of nurses leaving, that goal may be harder to achieve than ever.